Okay.
I'm trying. Hold on.
Well,
Nope,
it looks
not
like
that
we're
one.
recording. So,
Yep. Hold on. Not that one. Ah! I'm not sure. Oh, okay. Hold on here. I shared the wrong thing. There we go. Okay.
okay. Well, we already, Jeff did roll call, recorded everybody that's on the meeting. So the first thing, if everyone just wants to take a look at the agenda for today.
Motion to approve the agenda.
Thank you. Do we have a second?
Second, Andrew.
All right. Anybody opposed? All right. Sounds good. And now the minutes from our meeting on July 13th. Do we have a motion for the minutes?
Motion, yeah. Motion to approve.
Okay, do we have a second?
Second.
Was that Michael or Rob? Oh, Philip. All right. Perfect. Okay. Any community comment? Does anybody, do we have any call-ins?
No, they can't say anything.
Oh, okay,
So if
sorry.
somebody calls in, they can listen. So I'm not really sure the mechanism for that. So we'll just go past it.
All right. So let's just move to the reports and recommendations. So the 2020 work plan progress review. We had 2 groups. I'll be honest, I think the last several months kind of thrown some people, myself included, from getting some of this work done. So the 2020 draft is what Jeff has on the screen right now.
So we kind of have our 2 that are still kind of pending. The first one and then the 4th one.
Mhm.
And I think they would be candidates to be moved to the next year's work plan. That doesn't mean that we can't work on them now, but it would be a continuation. The second one, which is the tobacco item, that's already done. And then the initiative 3 was that AARP thing, and that's been taken off. So, so I don't know if I guess it sounds like the 2 groups have not really met. So maybe that's just the way we look at it, is we're going to move these to the next next year, and then try to maybe establish some, I don't know, some stuff to work on before the end of the year, and then continue towards next year.
I was thinking
I don't know,
about
people.
earlier. I was thinking about that earlier today, that maybe we could move them to 2021. And just as a side note, if this is agreeable, that first initiative is about finding ways to bring some of the groups that um, to get some social connectedness into the community. I was going to suggest that if it's agreeable to anybody else, we could actually put the matter of the Vitals app in with that initiative one, rather than create a separate initiative. That would be part of the first. I don't know if that's not agreeable to you, fine, but I just thought I would suggest that.
Yeah, that's interesting. I guess I hadn't thought of it that way, but I wonder if that would make sense.
Like I said, it's talking about including examples of local government initiatives from around the country to reduce social isolation. I mean, okay, we're talking about more of a safety sort of thing, but if I could have an opportunity to phrase it this way, I think safety for autistic people is a means of trying to prevent social isolation. Where that app is designed to help people with mental disabilities and developmental disabilities to feel like they're not singled out, but to actually have a way to for the first responders and everybody to be aware of them. So, like I say, perhaps instead of creating a whole separate initiative to do that particular thing, perhaps that could just be added to initiative one.
Does it, my question is, Tracy, does it even really have to be added? It seems like it's an outcome of your study and report potentially, just like any other technology might be, any other solution. It's just one of the things you're reporting on.
Yeah, that's a good point.
Can you remind me, is that a government initiative, or do we need to expand the wording of initiative one to include local government initiatives and governmental partner initiatives?
That might not be a bad idea anyway, if I'm going to jump in again, because I think coming out of COVID, we're going to find all kinds of things that fall into this category that might not be government initiatives. They might be private sector initiatives. They might be, I don't know if schools are considered local government or not, but I mean, I think throwing it open, you're going to get a cast a much wider net and get a lot more solutions potentially.
I agree with that.
But then we probably do have to reword it, I would think.
Yeah.
To say local government and private initiatives, or?
Yeah, that sounds about right.
Do we even have to, we just say examples of initiatives from around the country and just get out of where they're coming from?
That would be the most efficient.
So it sounds like we're going to kind of include the vitals into initiative one and carry that over to 2021.
Yeah, like I said.
Okay.
Yeah. We still have to kind of put together what we're going to do in terms of like contacting the other communities to see how it's working for them, like Bloomington and Richfield. We said we wanted to do those things, and I guess the issue is going to be who's actually going to do that, and who do we actually approach, that sort of thing. So a lot of that still needs to be worked out as far as logistics is concerned.
Yeah, I think that could be a good kind of a good example, or kind of a first test of like, okay, we've heard about this initiative in XYZ city. It seems like it's related to this initiative. How do we get information about it and include that in the study and report? And that could be kind of the first attempt, is to work with our partner cities and try to find somebody that could give some feedback on it. So it could give a roadmap for maybe some other research and things that maybe aren't quite as local that might be in other states or that kind of thing. So,
Well, actually, that Vitals app is actually a Minnesota invention. It's actually started here. But the other piece of it is that by going to the other communities, we can find out what's been working, what hasn't been working, and then, like I say, I think the idea was to ask them to get their feedback so that when we, as far as working on it, we can say, this is what's been working for Bloomington and Richfield or St. Louis Park, and that way we have a little bit more evidence that it's actually been helping, I guess.
One thing that I'd like to point out is we probably shouldn't ignore the first part of that sentence before the comma, which is to study and report on the benefits of social connectedness. I haven't been doing any active research, but several papers and essays have kind of fallen into my lap over the last few months because it's obviously a major issue right now. So besides just finding examples, I think we also need to put together a strong case for the benefits of social connectedness in order that all of those governmental and private efforts actually make sense, that they're accomplishing a desirable purpose.
I think I might add one point, and that is, how do we actually study and what do we find out about such things when we're dealing with so much social distancing right now? That to me would fit into this, most appropriately. So.
Yeah, I think had it not been for the pandemic, that several of us would have been meeting in small groups and would have made a lot more progress. So that's a salient point.
Yeah. But I mean, as far as these communities that are being impacted by this, the people that we're wanting to bring into that social connectedness, I think it's worth it to, and I don't know how this would be done, but I'm thinking about how this social distancing is impacting those groups of people, and how can we actually make them more connected in this time of social distancing, a pandemic, all the things that are happening. That's my thinking. So.
Okay. And then, so Greg, we've already addressed 2, and we've kind of set aside initiative 3, and then initiative 4. I definitely think that's something that can go on next year's plan. It just, I don't think, we just didn't get to it with everything else in the world. Are everyone else working on initiative 4 okay with moving that next year?
Yeah, I think that's fine. We want to slide it
That
back.
makes sense.
Okay.
I have a question, Julia. Is there a sample of what a study and report looks like from prior years' commissions that for us new folks we could get a look at so we know kind of what is entailed in doing that?
Yeah, excellent question. Jeff, do you have any studies from previous years on stuff that you'd be willing to share?
I will see if I can find something
Okay.
while we're chatting here.
Okay.
But
the documents that were produced for the tobacco 21 and maybe the vaping the flavored vaping
Mm-hmm.
might help with that.
Yeah, I think they're a little more, they're like research and recommend, or study and recommend, which is like the third level. Study and report is like the first level, so it's a lot more like just present the facts.
Mhm.
I'll see if I can find one.
But those documents include the facts. You know, if you just truncated the recommendations part, it would at least give a flavor of what's involved. You know, the research and the documentation. Because in this being my 4th year, I can't think of any other specific document that we've generated that would technically meet the requirements of a study and report.
No. So this is what can you guys see this? That it changed?
Yes.
Okay. So this was the Tobacco 21 submission. And it's in the council packet for this date. So you could see it on the council online. But this would basically be the same format, but it would probably be advisory communication also, and then from the commission, and then it would be like study and report on such and such is kind of what the subject would be, and then any kind of attachments that would go with it, and then kind of a summary of well, it's not really action requested. It would be more like the commission is asking the council to accept the report regarding this work plan item, and then kind of description of it, and then the report would be attached. So that's basically what this is. I mean, this is a lot longer, but I think this is 3 pages, and then the attachments. So, which there were plenty, and then the ordinance and stuff. So that's kind of the layout of it. It'd be real similar to this. But the study and report is really it's not asking to present an opinion or ask for an action. It is, we have gathered this information and assembled it in this report, and we are presenting it to council. And then if council decides, if we have a bunch of examples like the Vitals app or some other initiatives, and they're like, whoa, we should take this one, and we should try to do it. Then the next year, it might be a community health commission, do a research and recommend on XYZ initiative. So then it's more like go out, find more detail, more logistics, how would this work, and then make a recommendation. So I could see it being like a 2-phase thing. So, but that's what it looks like.
Thanks, Jeff.
Yeah, that's really helpful. Thank you.
Are there any of these parking lot issues that we want to talk about moving up to 2021? Do we want to wait for council to come back with some ideas? I'll go over the parking lot ideas just in case somebody can't see them on the screen. Local opioid efforts, including police-led take-back programs, campaign, and how do we know if this is available? Statement by city regarding firearm safety, I can't read it apparently. Firearm safety or gun violence, technology and health, social media, isolation, and bullying. I think some of that isolation might go into that first one we were talking about. And Edina Public Schools, lack of provision of feminine hygiene products in restrooms.
I agree that technology and health one, social media, isolation, and bullying probably could be added to number one.
Okay.
I'm not sure the Edina, the schools is right for this, but I think that's a pretty big issue for the women, girls in the high school do not have access to that. So if we could possibly do anything to that, I think we should.
Okay.
I'm trying to think about how that would translate into a work plan item. Maybe it's more of a, maybe it's like a contacting thing or something, like a contact with someone at the school. I'll have to think about that.
You also I also wonder how people, I mean, with the current pandemic, there is, meal assistance for children who are school age, who are not getting food or nutrition services at school. I wonder if that's something that could also be brought up too in that realm, because if it's something like that that would be supplied at a school, would be
Is that more a school board issue?
maybe, I don't know.
Doesn't take care of it. The community could also always step in and take care of our residents, or try to.
Yeah. I could put Amy on the spot as our student liaison and ask if that's something that she is interested in. Because I think that was something that, did you bring that up in the past, Amy, or am I just not remembering things correctly?
It is something that I am interested in, but I don't remember if I brought it in the past. But just seeing how important these services have been in light of the recent events, I think it's important to pursue.
Okay.
I think a good first step would probably be me calling somebody at the school and saying, "Hey, are you aware of this?"
Right.
Or what is the situation? Because this has been discussed at our meeting, and is this the policy that there's at all, or why, if that's true? Is it a resource thing? Is it a, I don't know. What is it? What's the situation? And then kind of seeing where it goes from there, I guess.
Are
Is it
you
something-
talking, which one are we talking about? The lack of feminine hygiene?
Yes.
Or the nutrition?
Well, products
Ooh.
in the
It's unclear
restrooms.
which one you were asking Amy about, sorry.
Oh, I'm sorry. I was asking about the hygiene products.
Oh, I thought you were talking about nutrition, but I think the hygiene products
Both.
were brought up by a previous student member, but both Madeline and myself were very interested in making hygiene products more accessible to high school students.
Okay. Sorry about the confusion.
No worries.
My thought is that would this be something that we would just make the recommendation or request to the school board to take care of, or would we actually, I mean, how would the Community Health Commission do this in terms of you know, making this a requirement or whatever. I mean, exactly what would we do with this that could change what's happening? I guess I'm asking that question.
Yeah, I think it depends on what the situation is. You know, if it's that the school just has a stance that we're not going to provide these things because we don't want to spend the money or whatever, whatever the reasoning, you know, maybe that's something like, okay, can the city help in some way to make this happen? Maybe it's a grant, maybe it's something, I don't know.
Right.
But if it's like, well, we try to provide them, but you know, something happens and they, I don't know, that disappear. I don't know. I think we don't know enough information right now, and I think that's I think I should make a phone call or try to talk to someone at school and see what the situation is and what the intention is of the school, and then from there, you know, that's going to dictate a lot. I mean, we can't mandate it. We can't, you know, require it, but we could encourage it or look at, you know, are there initiatives like these other ones? Are there things that happen in other places that are successful? And why, you know, can we do that? So, need a little more information first, and then I think that'll dictate where it goes from there.
Okay.
So I'll try to make a phone call.
Sounds great. Thanks, Jeff. Okay. Is there anything else on this?
What about that opioid part? I mean, that is something that is a really great concern, period, around us these days. Are we going to do anything with that, or are we just going to leave that there?
I didn't catch that first part. Which one did you mean?
The first item on the parking lot.
Oh, okay.
Opioid efforts. That is a great concern for many around us, especially with how it's affecting our veterans. So I'm just asking, are we really just going to leave that in the parking lot, or do we want to try to do something with it? That's my question.
I had originally proposed that as something we could look into, I think last year, and it was placed in the parking lot. But personally, especially given the influence of the pandemic on the incidence of opioid addiction and dependency, I would be in favor of elevating it to one of our initiatives. Not so much that we're going to solve the problem, but at least make sure that we have in Edina whatever programs, you know, take back programs, needle exchanges, whatever, you know, whatever it takes to try to mitigate some of the damage caused by opioid addiction.
I think that could be another kind of a similar study and report kind of a thing to try to find what are the possibilities that we could do and present those possibilities to council. And then if council grabs onto it, then it could move to kind of the next step, I think. So I think if we wanted to word an initiative, it could be similar to number 1 or number 4 about studying examples or reporting on examples and options for what could be in place locally.
I have a question about how, so I've seen Hennepin County and like on next door, the sheriff's office post things about what they're doing with the opioid crisis and different types of actions. what's our Edina's relationship? Like, I don't think we want to duplicate that since aren't we kind of in the Hennepin County, like those services are available to all the residents, correct?
Correct, they are available.
So, I mean, maybe we should be a little more, I mean, study and report is, this thing is going on currently. Maybe we need to take it up a level and just help figure out how to, maybe part of that study and report is figuring out how to let people know about it and get it better publicized, what Hennepin County is doing as well.
And that's actually included in the parking lot, brief statement there. I think it's important also.
I know the coordinator is currently out on maternity leave at the moment. And I don't know when she'll be back at this point, but for Hennepin County at least. But I mean, that's definitely something that if you want to explore further, I can help set that up, or look into that more.
I agreed. I mean, does everyone agree that we should put that on bump that up from the parking lot to the work plan?
That works for me if other people are interested.
Yeah, if it's as simple as a sample message, for what's already out there, I don't think there's any harm in trying to do that and connect people with services that are already being provided that they just might not be aware of. So I mean, at the very least, I think that's definitely exploring.
Yeah. I agree with that.
Okay. Anybody disagree? Are we all neutral to in agreement?
Sounds like no opposition.
Okay, sounds good. So I guess the coordinator is back. I lied. I thought they were still off, but it is not off. She's not off anymore. Whatever what that's worth, let me know and I can set something up. Do we want to move something else up and have 4 items, or are we good with see what council comes back with?
Well,
I have
the other one.
I have grace screen in front of me. Does anybody else have that issue right now? I'm not seeing an agenda or anything right now.
I see a gray screen as well.
Oh,
No, I don't.
There we go.
No.
Is there a timeline for when we can consider what we move up and what we don't, or can we do that at any point during the year?
It's pretty set. The work plan is kind of set in the fall, late fall, and then it can, if something comes up and needs to be addressed, we could go to council and say, we'd like to address this and amend the work plan. It's possible, but we don't do it very often. Just take some time.
The second one on statement by the city regarding firearm safety, is that how often does the city put out statements, and in what form?
Not very often. It's usually a reaction to some kind of event, something happening.
Well, the only reason I mean, you've got hunting seasons just right around the corner this fall. And it'd be pretty simple to, just on firearm safety, just put together some reminders, for hunters, if that's, and then how is it broadcasted or sent out, the statements?
Yeah, usually any kind of public or statement or proclamation or something like that, it gets presented at a council meeting, so that's broadcast on the local channel when the council meetings happen, gets put in Facebook blasts or city announcements that way, our social media platforms. Sometimes media picks things up, like when Tobacco 21 happened, that was all over the news. So it really depends on what the item is. A lot of times we have it's Public Health Month, and when it's something like that, or it's Public Works Month, there's a proclamation at City Council, and it gets included in the broadcast because it's at council, and there might be I don't know, maybe there's a press release or some kind of note on a social media platform, but that's about it. So it really depends on how I guess you're gonna say how interested the public is.
Jeff, there's a gray screen again, just
Somehow Dina was not able to get on the meeting, so I'm emailing her, and just give me a second.
I can share mine if you want.
Okay.
I don't know if I can because I'm not the host.
All right.
That's all right. So I mean, we can leave the fourth one blank if we want. There we go. Thanks, Jeff.
Yeah. Yeah, I mean, I think 3 is fine. I mean, obviously this year is still topsy-turvy, so if we can make some progress on our 2 existing ones, and then plus come up with some language for a new one, I think that's totally fine.
I feel like you never know what could come out of left field either.
Right.
So, okay. So are we in agreement with those 3 items? If anybody is not in agreement, please speak up or raise your hand. I don't know if there's a raise your hand function on this. There isn't, so I lied. On Teams, you can raise your hand. So, okay. All right. Making some progress.
So I think what we'll do is maybe Julia and Andrew and I will try to reword those initiatives, and then send it out for comment or whatever, and then that'll be what's presented to council here September. I'll have to double check, but it's coming up when the council gets kind of the first look at work plans. So
sounds good. Just we'll work on that date. When we know what that, if you wouldn't mind just letting Andrew and I know what that the due date is for that, that'd be great. All right, well, if there's nothing else on that, can we move to member comments?
A question for Jeff. Has there been any information come up on the lawsuit that RJ Reynolds has brought against the city?
it has been quiet. I have not heard from the city manager about it. He's not really asked me to weigh in, or I don't know what he would ask me to do, participate at all. So I'm assuming it's just moving forward, how those things move forward. And if something changes or he needs some input from me or us, I'll let you know. But as far as I know, nothing's happened at this point.
Okay, thanks.
I was going to comment that whoever wrote this statement in support of masks and the mayor's, I thought that was really well done, and assume it got pushed through, whatever those mechanisms are, but I thought it was a nice support mechanism.
Yeah, it was in the council packet, August 4th, last week. So
At the time the council saw it, what was it, just for the support for the city, or by that time the state had the mandate as well? Did it support the state mandate?
yeah, we added some language in there that basically just it kind of mirrored the same support for the city initiative as for the state. So it really didn't change the tenor of it much, just kind of encompass the state initiative as well.
Yeah, great.
I'm interested to know, Jeff, you remember the matter that I had some people, someone raised an issue that the Walgreens on Vernon, that people were not wearing masks in there. It was brought up on Nextdoor, I believe, and all I did was suggest that they contact you. What happens with something like that when it's brought to you? What do you do with it, just out of curiosity?
Sure. So our main mechanism, our main response is a phone call and some education and discussion. So, in a situation like that or any other local store, we would call and talk to a manager and just say, hey, we got this call. Are you aware of the rules? Do you have the preparedness plan in place? How do you handle it? How are you going to address this with your employees? Or we usually try to say, this is an opportunity for you to have a discussion with your staff, kind of a thing. And so we really just give them a good reminder and a discussion and see if they have any questions. And then if we get repeats, we're starting to talk about, if we have some chronic problems, what are our enforcement mechanisms and how heavy do we want to be with those? Whether that's revoking a license or, some kind of other penalty. It's, once you get beyond the education mode and you go into actual enforcement, it's a pretty significant step. So the governor, the leadership from the state and the governor has been education, education, education. So that's the way we approach it first, and we try to get compliance that way.
Are there any other comments, questions?
Jeff, a lot of the offices and buildings some of them are scheduled to open up after Labor Day. But I know this thing is fluid. What's the city hall? Do they have a timeline yet?
I have not heard any timeline. It's open right now for absentee voting. So there's some processes in place for that. And then But I've not heard, I mean, we have a, what are they, like a back to work plan that we're working on, but there's been no, like, it's going to be this day or this month even. So I do not anticipate it to be, City Hall to be open to the public in the near future at all.
Well, I don't have anything. Does anybody else have any comments? Or if not, we can move to Jeff for staff comments. Anything you want to talk about?
I guess the main thing that has come up recently is there's there's beginnings of discussions about a kind of a community testing site being set up at, I believe it's Jefferson High School in Bloomington. There's not even a date yet, but it would be like a 1-day event kind of a thing. They're talking about 1,000 tests in some kind of drive-through mechanism. So that's basically all I know at this point, but it's starting to be discussed, and that was the site that was chosen. So there might be some Bloomington, Edina, Richfield staff that help with kind of the logistics of that day or the operations of that day. Maybe that's directing traffic or that type of thing. So I'm not sure how much me or my staff will be involved, but it has some potential for that. Otherwise, we're in this mode of kind of static operations. Our staff are doing rental inspections. We're doing food inspections. So that's okay. I know our building department is busy because lots of people are remodeling now. But otherwise, yeah, we're just kind of status quo, I guess. So that's all I've got.
How is the composting program going, Jeff?
You know, it's actually Twyla was on vacation last week, so she got a well-needed break. But I think it's going okay. A lot of questions during the real hot weather about smell and maggots, that kind of thing. So a little bit of some frustration with that. She's actually helping or giving some advice to some other cities that have called to ask about it and are looking to do the same thing we did, a citywide collection, not necessarily a, opt-in or choice kind of a thing. Mm-hmm. So she's going to give some feedback, maybe start in the fall so that it's in the winter time when it gets really going. So we'll see. But, it hasn't been a big point of contention recently. So I don't know if that's because COVID is a distraction or what, but it seems like it's been going okay.
Great.
This seems like one to me that a lot of positive reinforcement would help, and again, some communication to remind people why it's important. Because I think people who aren't used to composting or organics recycling really don't necessarily understand how big a deal it really is. So I don't know if she can do anything about that or if there's more communication planned, but communicate seems like kind of a word.
Yeah, that's definitely in the plan. That's that once this gets kind of set up and going, a lot of her position is going to be communication, coaching, connecting to resources, giving people advice and guidance, that type of thing. I mean, she was ready to set up like workshops and all this in-person stuff, and now we can't. So, I mean, like everybody else, it's, we've had some derailment. So that's the plan. We just have to figure out how to do it in this new mode of operation. So. But I think that's all I've got.
I'll move to adjourn.
Okay.
I will second. Natalie, do you want to
Okay.
say hi to Amanda? Go ahead. You
Hi,
can wait.
Amanda.
Okay, who was adjourning? Was that Tracy?
Yeah, it was Tracy.
And then who?
Leah.
Okay. And no one's opposed. Then we're adjourned.
All right. Thank you,
Thanks,
everybody.
everybody.
Thank you.
Bye.
Thanks,
You too.
everyone.
Bye.
Have a good night.
Hi, Amanda.
See you next month.